Hello and welcome to Workforce Wisdom. I'm your host, Christy Bray, Chief Customer Officer at PracticeLink. This podcast explores the latest trends in healthcare recruitment, highlighting innovative strategies, success stories, and fresh perspectives that are transforming the healthcare workforce. These episodes lead to in-depth, thoughtful discussions with recognized industry-leading healthcare professionals, exploring the challenges of recruitment and beyond. Whether you're an experienced recruitment professional or just starting out, this podcast aims to help you discover how experts are reshaping the industry, leveraging technology, and fostering inclusive hiring practices. Today's episode, The Future of Patient Access, Workforce Efficiency, and AI, with Alex Zoller. Welcome, Alex.
Hi, Christy.
It's nice to have you. For our guest, Alex is a healthcare technology entrepreneur and product leader focused on transforming access to care through AI. He is the co-founder and CEO of PatientGenie, an AI-driven platform that automates provider matching, scheduling, and care gap closure for health plans and health systems. With more than a decade of experience in digital health, Alex has built and scaled products at the intersection of virtual care, automation, and healthcare operations. He previously co-founded Overlay, a healthcare automation startup that was acquired through a series of consolidations, culminating in a deal with Teladoc. He also held senior product leadership roles at InTouch Health, where he led the development of Solo, the enterprise virtual care platform now used by more than 300 of the world's leading health systems. Alex approaches healthcare delivery through a systems lens committed to removing friction from the patient journey. His personal experience surviving a major cardiac event reinforced his belief that timely, coordinated access is essential and that AI can ensure no one misses critical care due to avoidable barriers. Outside of work, Alex enjoys spending time with his family and playing pickleball. Welcome again. Alex, you've built your career, really, as I mentioned in that intro, at that intersection of healthcare and technology, lots of innovation. What initially drew you to focus on patient access and care navigation as a critical problem to solve?
Once again, glad to be part of your podcast today. So, as you mentioned, my experience spanned over 15 plus years, I guess, in healthcare alone, building all kinds of technologies. And a lot of it was really focused in helping providers. But this journey taught me that patients are burning out too. And it's not just from the lack of having technology, it's just the way the technology is built and deployed. About a year ago, I had a personal healthcare episode where I'm a pretty healthy guy, exercise, eat well, but still had a heart attack where 3 of my arteries were completely blocked. And there was no warning signs, no symptoms building up to it. It kind of hit me out of nowhere. And working in the industry every day, I missed the things that I should have paid closer attention to, like my family history. I knew I was overdue for an annual physical. And still, just like many people, I didn't get the checkups. The life, everyday things just prevents you from getting the care you need when you need it. And there was something else, that there was really no system flagged that I was overdue. There was no outreaches coming to me, no nudging or scheduling. And that gap, that silence, is exactly why we wanted to build PatientGenie. Because access to care, it's not just having a directory, it's not just finding the doctor or knowing where to go. It's more of an action problem. It's about making timely, appropriate care actually happen. So people don't quietly fall through the cracks until something serious happens to them.
And as you've mentioned, really PatientGenie is focused on addressing that fragmentation, that delay. One thing we'll talk a lot about today is really that rising cost. So as you look at those challenges that really affect the patients, the providers, and the insurance payers, how did your background shape the way you approach these issues differently from what we've seen traditionally in healthcare solutions?
I think it's more about my product builder mindset. It's analyzing to see where people drop off and what does it take to complete the workflow. And my past experience was a lot of it focused on making providers a lot more efficient and extending ability to connect with patients outside of the four walls. But looking at the current environment and just looking to some data points, where 61% of patients skip care altogether because of how much hassle it was just to finding a doctor and schedule. Health plans waste billions of dollars on inefficiencies and just trying to close those gaps in care. And still, majority of scheduling today occurs over the phone. So when we take a look at all of these numbers and statistics and just the problems that exist and inefficiencies, we really wanted to focus on how do we address the need, not just inefficiencies, and not just from a cost perspective, because it is extremely important. A lot of cost today just goes into all kinds of administrative tasks, but just from effectiveness of the existing solutions. And a lot of them just fragmented different solutions. And it takes really a lot of personal time. And I know we all navigated and we all try to finding the right doctors and then spend countless hours on the phone trying to schedule. So how do we help solve for this inefficiency? And a lot of that inefficiency today falls on patients. Like nobody takes into account how much time it takes a patient to actually find the right doctor or schedule the visit. But if your door is broken, then the rest of it is broken as well. And that's why we wanted to focus on saying, okay, well, how do we address that? The first step to getting care is actually getting that appointment scheduling. And that's really where a lot of bottlenecks were. And if we look at the priorities and we said, okay, well, let's address the first problem on that list.
Mm-hmm. Very good. And I think that as somebody who's worked within some large health systems, whenever you go in and look at those pain points and that friction, and you think, well, it's fine, the call system is working or the people are answering the phone, and it's much more beyond that. I'm sure that's what you guys uncover when you implement technology like PatientGenie, that you're absolutely right. And I think that barrier to most people, they give up and then they go without.
Yeah, and then they end up in an emergency room. I mean, the problems don't go away. The healthcare problems, you have an episode, you feel some symptoms today. Just because the symptoms disappeared, it doesn't mean the problem went away.
So now we've watched the rapid evolution of telehealth, especially in the last 5 years, right? Which is amazing to see. Lives have been saved and will be saved as that continues to evolve and grow. But from your perspective, where does that virtual care component fit within the future patient access and maybe the overall care delivery strategy?
I spent part of my career building virtual health platform, and I was fortunate enough to be there at the right place at the right time and helping a lot of organizations to stand up virtual health overnight to support their patients during COVID. And I think there's still a lot that's going to be improved, and we're going to see telehealth covering a lot more areas where it hasn't in the past. It's more than just the video. It's the entire workflow. And we keep seeing more advanced models, including, let's say, robotics and remote assistant procedures in a certain context as the tech and clinical models mature. But I think as we look at access and kind of the problem that we're trying to solve today, we have a lot of areas and rural areas in the country where healthcare is just not available, especially when it comes to providers with certain areas of expertise. And I think the telehealth gives us that ability to deliver access to those areas that otherwise would not have any access to care at all. So when you address the problem from the very beginning, from the digital front door, and you try to consolidate multiple access points into a single seamless solution, you'll see that telehealth is going to get even higher utilization just because it's the right care, right provider at the right time that you're able to deliver to some of the areas that otherwise have no care access at all.
Yeah, I know when we talked a couple of weeks ago, one of the things that I think about is that the patients in those rural spaces will now, I think, have more access to specialty care than they have before. The ENT or the Euro, or, they will have, I think, more specialty access where before that it's just been so limited because there were not providers choosing to live and work in those areas. And doing some outreach once a month is nice and that helps support the community. But having that telecomponent overlay with that really, I think, expands the spectrum of what these communities have access to.
Absolutely. And I think when you look at telehealth is just a single modality, but it's really not a strategy. The strategy is appropriate care with closed loop follow through. So telehealth being one of the modality components on a larger scale, yes, it delivers access to areas that otherwise don't have any care. And this is a good way to solve that problem, but it can't just be the only solution available.
Okay, let's get into a really hot topic right now. So, agentic AI, and I am still learning and understanding what all of this means, but gaining a lot of attention in many industries, not just healthcare. But how do you define agentic AI, and why is it particularly powerful when applied to patient access and care navigation?
So the way I see it is, I guess agentic AI is not just answering questions. It's not just your chatbot, right? It's the software that can take actions, complete tasks across systems under defined guardrails to achieve a particular goal. And specifically when we're talking about access, the goal is right provider, right setting, scheduled, confirmed, done. So you have a lot of these either directories or health information systems or content. And it's great. That's where you can use the chatbot just to answer questions and provide you some insights, but it's not going to complete the job. Right now, the emphasis is still on individual to piece all of that information together and then still do the work. And I think really that's where agentic AI comes in. It helps deliver results. It really helps completing those tasks.
So specifically to PatientGenie, how does PatientGenie and your technology use agentic AI to guide patients towards that right level of care? Probably some different care options, virtual, telehealth, rather than defaulting to the higher cost of an in-person setting.
Early on, when we started PatientGenie, we acquired 4 patents on how to analyze just providers' availability and their qualifications and skill sets against individuals' needs, insurance coverage, benefits design, top of license requirements. So really, how do you help manage resources and then match those resources, the available resource or the best matching resource with patients' individual needs and personal preferences. So when we build the guide and navigation, we take into account multiple characteristics and then analyze them and then present what is best appropriate. Is it virtual or it's in person? What is the top of license requirement to deliver this particular care? Do you need to see an MD or DO, or can this care be delivered by a nurse practitioner or physician assistant? And we can free up the doctors, MDs, and DOs to a higher acuity episodes of care. Because most of it, it's just, we have shortage of providers in the United States, right? The data shows there's not enough doctors, not just primary care providers, but specialists across the board. So how do you best utilize those resources against higher acuity, or what we call top of license requirement, versus bringing forward nurses and NPs with a particular skill set and licenses that can deliver and solve easier or lower acuity use cases?
As organizations are really looking to adopt AI across many continuums, but you kind of see them start with some back office functions or maybe that assistive property. But as you mentioned with agentic, it's actually solving or completing a task, not just being able to provide a little bit of feedback. So where do you see the most significant opportunity for AI to create real value for patients and then our workforce today? You mentioned the physician shortage. We talk a lot about that on this podcast, but where do we hope to see the greatest benefit for the patients and the workforce?
I think addressing a lot of administrative tasks. And I don't think AI is going to replace the human element altogether. At least I don't believe it's going to replace physicians at all, or nurses or other clinical staff. I think we have an opportunity to augment a lot of the work they do, particularly on the administrative side, and not just on the clinician side, but also on the patient side, so they can focus and dedicate more of the time to actually treating and caring for the patients. So it's things like scheduling, obviously, rescheduling, referrals, outreaches, that nudging, which is, I think it's extremely important, reminding people, especially in the preventative wellness care, that these are the things you need to do. Closing open loops, reducing call burdens. There's a lot of stuff that's done today over the phone. And it's not just scheduling a visit, it's on the provider side as well. It's getting prior authorizations, getting the missing details on the plan side, on the patient details, getting referrals, getting your charts forwarded. This big promise of healthcare interoperability and things like that. We're still years, if not decades away from everything to be streamlined and working. A lot of that today falls on humans, on people doing that work manually. And a lot of times it's still done over the phone. And I think really the true value that we can focus on today is addressing this administrative. And administrative financially, I mean, it's a huge burden on the system. The data shows 25% of every healthcare dollar is spent on administrative tasks. So it's about $1 trillion a year in the United States alone. So there's just a lot of value that AI agents can deliver, and maybe not address 100% of it, but I think close to 50% of it in the next 5 to 10 years could be addressed with AI.
Our founder talks a lot about integrating AI into your daily workflow to be that assistive component of your work. I often joke about it, it's kind of like having an assistant or maybe the little data analyst to the side where you can run some problems to it and it gives you those opinions back. So it's great to hear, hopefully, how in the future some of that administrative burden could be offloaded into AI. Do you foresee, and it may already exist now, but government barriers, payer barriers, like healthcare is pretty reluctant to change. Change happens very slow. It happens a lot, but it happens very slow. Are there some pieces in place now that put roadblocks in the way of a technology like PatientGenie or other things to help reduce that $1 trillion burden?
I think a lot of it is validation. And we've seen a lot of that in 2025 this year, that at the beginning of the year, there was a lot of hesitations. Can the agents do that? Can they do that consistently? What is the percentage of error? Comparing it to human factor as well. But then, as we said, there is shortage of physicians. There is just shortage of all kinds of physicians here in the United States. Even the call center cannot hire people fast enough. And a lot of it is because the data has to retain in the United States. So with deploying AI agents, we're number one, addressing the data leakage. Yes, the data is going to stay in the United States. It's not going anywhere overseas to less expensive call centers. And the validation that we've seen this year is, do agents sound human-like? Do they deliver the same empathy an individual can deliver? Are they addressing and answering all the right questions in exactly the same manner every single time? And we've seen a lot of that, and the progress that we've made, and I think technology as a whole had made this year, is that, yes, we can validate that the accuracy is there, that the empathy is there, that the agents will stay on the phone, answer all the questions. They're not in the rush to hang up the phone and take the next call and run somewhere else. And we also have the capacity to scale. And with that, the scale and lower cost, we can just address a lot more issues that today are not being addressed, just because you don't have enough call center agents, you don't have enough people. And a lot of these concerns, whether it's gaps in care and others, just get buried under the rug because there's nobody that can attend it. And it goes down to not even deploying certain analytic tools, because they're going to uncover more problems, right? More gaps in care. And people are like, well, I don't want to know about it because we have no ways of solving that. And I think right now with this capacity and this capability that proves to be working for people, accepted by physicians, clinical staff, and we see that again and again, like even in our own use cases, the front desk actually prefers talking to our agents instead of talking to individuals, because when our agent calls on behalf of the patient and tries to schedule a visit, the agent, one, will have all the details needed for that visit, whether it's insurance details, reason for visit, history of previous visits, referral, everything prior to making a call. The agent will not be upset being on hold for 45 minutes or the fact that it's the fifth call it's making. The agent is not in pain, so it will also deliver this information clearly without any hesitation. And we also see that both our agent and the front desk have the same intent. They both want to schedule the visit. So we see a lot of validation that it addresses the need of the individual, delivering this digital experience, but at the same time, it's being accepted by the front desk and the clinician side that's saying, okay, well, maybe it is a better way of interacting. And we are able to get these appointments scheduled much faster than otherwise interacting with humans. So I think the progress we've made this year in the 2025, getting the validation, getting the acceptance, and just addressing the needs of the market, help move the regulatory and everything else along as well.
That's great to hear. And I would think that it would help to reduce friction just by standardizing some things. So like you mentioned, you can have some standard paths. I know I used to be a scheduler way back in the day for a very busy cardiology clinic, but there are a lot of pathways of entry for these patients. They don't often know why they're calling or why you're calling them. And so I would imagine that if you teach the AI and it's got that knowledge in its back pocket, you've actually booked the correct appointment type for that patient, relieves the physician's schedule to focus on other tasks or things that they have during the day, that standardization, I think, would be very beneficial, just knowing how much runaround usually happens with scheduling and getting patients in the door.
Absolutely. And patients, a lot of times, and me personally, we don't have enough literacy to make the right decision. My ear hurts. Do I need to see an ENT, or can a nurse practitioner over telehealth identify that I have a minor ear infection and prescribe the medication that I need? And I think that's where AI can help. It can answer our questions without tying up a person or front desk or a clinician, answer the question, or prepare us which questions to ask when we go into the visit and when we finally interact with our physician as well. So I think there's a lot of help that it could deliver, and it does, in such a short period of time.
We've talked a lot about delays in care. They are the driver and the reason for poor outcomes, dissatisfaction, and then higher costs. How does intelligent care navigation really help patients access appropriate care faster and with less friction?
A lot of issues we're having, and my personal experience is delaying in getting the care, and then more extreme episode does happen. And I think there are two sides to it. One is informing us, individuals, patients, that we need certain care and how to go about scheduling and finding the right provider who can help us. But at the same time, on the physician side, is helping manage the right resources. So the resources are available to different episodes of care that better align with the license requirement and the skill set against the problem that's presented. And that's really where intelligent navigation comes to play. On one side, it helps an individual identify and present the right choices, whether it's modality, setting, or the type of provider they need against the problem they have. And on the other side, help manage the provider resources. Okay, well, knowing that I have these 50 or 100 providers in the group and their specialties and characteristics and qualities, how do I align the individual needs against the provider and their characteristic to best of our ability, knowing that I historically could be presented with other problems in this particular day, this week, and so on. So that's where intelligent navigation can come in. And it's hard for us just to have that knowledge, or on the front desk side to even help them manage those resources accordingly. Because a lot of it comes to play, it's like, all right, well, who's the best to deliver the care? Is it the optimized resource, not just from perspective of care, but from a cost factor as well? Can 15 or 30 minutes of physician be utilized in a higher setting so their reimbursement rate is higher? Can this particular visit be addressed by an NP or PA? And is that a win-win scenario for both? You get a better access to care, more appropriate, and an organization like a health system or a hospital can also slightly improve their margins by just better managing their resources.
And I firsthand have seen that happen where health systems or the clinics have invested in those advanced practitioners, and consistently they are underbooked. The physicians are overbooked, and you just have to believe there's a percentage of those patients who could be cared for appropriately by that nurse practitioner or that physician assistant that offloads that physician's time and burden. We talk about appropriate care. What does that really mean in practice? And I know you've talked a little bit just now about how AI and virtual care can really help to ensure that patients aren't overtreated or undertreated, but give us kind of your thoughts on that term, appropriate care.
The way I see it, it's 3 R's: right provider, right setting, right time. I think that's how I see as the appropriate care. And it could mean different things for individuals. We have to take account individuals' preferences, maybe their ethnic background or religious backgrounds and things like that. Social determinants of health play a big role. What's the right setting or the right time could be as well. Our ability to connect or drive to a particular facility. Do I have the right device to engage in telehealth, or am I better off being served in person? And vice versa, if I don't have a transportation, could this particular care be delivered to me over a telehealth? So healthcare, like anything else, should be very personalized. And that's why I think the 3 R's, as I say, the right provider, right setting, right time, could mean different things to you and me entirely.
So how should healthcare organizations rethink that access and that care continuum to be more holistic and patient-centered? And as you mentioned, it'll be different for everyone.
I think that's where AI can help in a number of different ways. Number one is maybe consolidating different digital front doors into a single approach. We're also seeing that a lot of patients, there is a deterrent by, I got to create another login. I have to go to a patient portal. I lost my password. And then there's been improvements on how to make that easier. But still, maybe there's a bit easier way to interact. Maybe it's easier for me to just send a text message and get a response and communicate through a text. Or for somebody else, it might be better over the phone. Not everybody wants to navigate multiple digital front doors. And a lot of times they're not even connected together. A number of health systems, you can go on their websites today and it'll be, okay, click button here to find a provider, and you get a directory. And then there is a completely separate button that says, oh, if you want a telehealth visit, you got to click here. And then you go to telehealth and you go down like the rabbit hole. You're going to answering a bunch of questions to realize the care you need is not offered by telehealth. So you go back to directory again. And then directory only allows you to search by a specialty. And you're like, I don't know what specialty I need. So you go to a different website to identify how your problem matches to what specialty. So I think there's an opportunity today with the help of AI to kind of streamline and improve that experience into a single seamless process that will help determine not just the individual needs, but also priorities of the organization and the management of their resources, how to prioritize maybe telehealth over in-person care. God forbid there is another outbreak, or just prepare more and more patients get engaged through telehealth just because of ease of access, or how to navigate them to what's available, what's important, and what's available now.
Did you know PracticeLink, the nation's most trusted physician recruitment resource, now offers PracticeLink Pro Marketing? PracticeLink Pro Marketing is a brand new, powerful recruitment sourcing solution built just for healthcare organizations. With custom strategies, targeted reach, and data-driven results, PracticeLink Pro Marketing helps you attract top-tier candidates and fill hard-to-reach roles faster. Ready to elevate your recruitment game? Visit PracticeLink.com and schedule your free consultation today.
We've talked a lot about staffing shortages, and you're right, it is not just the physician workforce in healthcare. It's top to bottom, I think, is a shortage area. And burnout continues to be an issue. How can the AI-enabled care navigation and then telehealth, like we've talked about, really help to relieve that pressure on the strained workforce?
Well, even if we take front desk, for example, right, that's the receiving side. And still, majority of appointments today, I think the data shows about 85% of all visits are still scheduled today over the phone. And for a number of reasons, providers don't want to expose their scheduling. The front desk works as that first line of defense, so to identify individuals' needs and to also be able to manage providers' calendar more efficiently. The front desk knows, based on the reason for visit and the complexity, how much of actual physician's time is going to be spent with that individual, so they can double book or triple book a particular time slot, knowing that a nurse or PA is going to take up most of that visit. But if you help an individual to better identify their need, present it to the front desk, they can spend less time trying to figure out who to route you to, who's the best provider to see. And we see our agents playing roles on both sides. We see agents helping an individual navigate through that process, as well as we see our agents being used to help the front desk to take the first call, to help navigate an individual, to bring them to the front desk who can answer the call and complete that last mile of that interaction. So again, I think we're going to see more and more agents being used across the board, not just with the HR scribes. We already see that helps convert provider notes into populating the templates. We're going to see where care managers and navigators, a lot of their work is going to be done through AI agents, all that nudging and follow-up and making sure that you follow your protocols and the care treatment plan that's been assigned to you on the member side or on the patient side, as having agents as concierge, really helping navigate, match, and get you to the right and the front desk. So I think it's happening. As everything in healthcare, it always happens slower than we want, but rightfully so. Healthcare is complex. It's not standardized. No two physicians practice the same. Even in the same practice, two physicians with the same specialty will have different intake forms. Just they have their own ways of asking different questions, and it helps them with delivering care.
You've touched on it a little bit here, but with that last answer, health systems and, as you mentioned, these insurance plans, lots of pressure for costs, reducing cost, improving access. It sounds like steering patients towards virtual care first, maybe these lower acuity settings. Like we said, it may not be the four walls, bricks and mortar. Do you have a sense of how much that will actually help reduce the unnecessary utilization, or maybe just that overall healthcare spending that I think is upwards of 3 to 4 trillion in this country? I mean, I know it's very, very high, but how does that help in these ways to steer some of that to a lower cost but appropriate care model?
I think from a health plan perspective, closing gaps in care is their top priorities. And it starts with something basic like matching you or make sure you have a PCP assigned and getting that annual physical exam or annual wellness visit. And I think that helps in a number of different ways. Just putting in the right category, especially with the chronic conditions and other illnesses, make sure you get the right care that you need and the resources are available to you. Because if you don't, then emergency room, it's extremely expensive, just from the cost and burdens, not just on a health systems, but on the plans from a cost perspective as well. So telehealth becomes a solution because this is a way of scaling your resources. We don't have enough PCPs. A lot of times you book and you try to schedule an annual physical exam and you're looking at 6, 12, or even longer months periods out from scheduling. So as ability to assign resources, this is just the first line of defense in many senses, how you can address this problem. Just allocating resources and making telehealth available is the first option. And it takes a couple of things. It's going to take regulatory changes, make sure that telehealth continues to be reimbursed equally as in-person visit. And we've seen a lot of it during COVID time, and hopefully will continue to be the case. It's educating people and individuals and patients and health plan members that you can get the same access to care over a telehealth. And we see a lot of that on the technology side, where you see telehealth vendors partnering with device companies, because a lot of us, whether we know it or not, we have great vital devices and other things, and our iPhone, rings and watches and all the things that we wear. The quality is medical FDA grade quality that could deliver these vitals and other information to that telehealth provider during the visit, that will give them ability to help diagnose and help deliver the right care. So I think it just takes healthcare. We have three kind of distinct entities. We have the patients, we have the health plans and providers, and I think working together on just educating, informing of quality and availability and efficiency and effectiveness of telehealth will help move more and more visits towards the telehealth. And we've seen a huge wave of that during COVID, and it worked. And then everybody's like, no, but I want to feel in touch provider now. So kind of the 2 years of not being able to physically see providers, we're kind of right now, everybody rushed back to seeing providers. But I think we're going to see us going back to telehealth just because of how convenient it is. And the fact that this might be the only care you can get in a timely way.
I've said it for a couple of years, so I probably need a new statement, but we're on the front end of the physician shortage for sure, but just the overall workforce in this country, that shortage, we're on the very front. It's retirements and things like that now, but in 5 to 10 years, it's people didn't choose medicine as a career path. And that's when we really, really get stuck. And I think that's where you see the numbers just grow exponentially with the retirements. But, when your net is not meeting the needs currently, it's just going to get worse. At PracticeLink, we see this growth on flexibility. So candidates are looking for flexible work environments, either if that's some hybrid, maybe it's some in-clinic days, it's some telehealth coverage days. How do you really see this type of care navigation complement what the workforce is asking for? So these would be new residents that are finishing their primary care residency and they're coming out and saying, this is great, but it's way beyond compensation. They're really looking for themselves to have that flexible work environment.
I think a lot of it starts with navigation and then being able to share the data back to the community. And we're seeing early on what choices people are making, how they're navigating, how they're searching for care, the decisions that they're making, the type of provider and type of care they want to see. And we see how it impacts and improves, not just on the health plan side, the gaps closures and improving the experience and the star ratings across, but also on the physician side, that they're benefiting from actually seeing the patients for not just a larger reimbursement, but for a higher acuity, the care that they would like to deliver. And then seeing other types of use cases just going to a lower licensed provider with skill sets. And then it opens up a lot of others, like a lot of people go into nursing now because they do want to deliver care, not just caring for individuals, but now with certain skill sets, they could be at the front end of it with helping with diagnosing, not just the treatment, helping deliver the care from start to finish. So yes, we see shortages across the board, not just on the physician side, but on the nurses side as well. But I think nurses, because it's easier attainable degree today, 4 years versus 8 years plus, And then you can pick up additional skills and licenses along the way that you could be delivering care. And we're going to see a lot of care being transitioned to nurses, in my belief, will be transitioned to nurses and physician assistants, especially nurse practitioners, just to solve for that. And because they can, with all other devices and everything else and all the information being presented to individuals, that a lot of care could be delivered by these type of individuals.
You mentioned having some remote patient monitoring right in your iPhone. There's just so many wearables now. I think that's what they call them. But as that continues to gain momentum, how does that telehealth, remote patient monitoring, agentic AI, how do you see that working together really to create that more continuous, proactive care model versus, like we talked about, that episodic interaction that's often limited by humans and our own lack of time in planning in our days?
One word that describes is completion. I think agentic AI is going to help close the loop between all of these different components and technologies. It's going to help connect your remote monitoring to telehealth, to agents. There's only so many integrations you can build and as fast as you can build them. And there are a number of companies out there, Validic is one of them and some of the others that really helped build the data streams from these different devices that now are going and becoming part of your EHR and the record system. But even that needs to be monitored and the tasks need to be created and those tasks have to be closed. So today, we will call it alert fatigue, right? So every time there's a data that streams, it creates alert and that alert has to go to the individual and that individual has to follow up. I think the AI and agents in particular can help close that loop and can help deliver actionable results on following up, connecting with the individuals, make sure that the data or alert that they received was actual, not just because I forgot to charge the battery or just because I misplaced my device or I moved it from left arm to the right arm and I forgot to notify. So I think a lot of this will help. And that's really how I see AI playing a crucial role in this. Just monitoring their alerts, monitoring notifications, completing the interaction and help close the loop.
So as you get your crystal ball out, I usually do this, but with folks, but especially in the technology space in healthcare, looking out ahead over the next 5 to 10 years, and 10 may be too long. Things are changing so fast. It might be the next 2 to 5 years. So how do you really see the agentic AI this intelligent care navigation reshaping patient access, the workforce demands, as we mentioned, and maybe just the overall patient experience with healthcare?
I think my view, how it's going to play out, most of us are juggling families, work, all responsibilities. It's really, healthcare was never designed for how the real life works. You have these different silos and they function within those silos. And I think in my vision that AI and agents in particular can help break through those silos and deliver a single cohesive experience. Going back to why we named PatientGenie as PatientGenie, our vision was that we can have this genie in your pocket kind of just help keep track of your family history, of other alerts, help you get to the right provider, navigate what that right provider is, schedule the visit, connecting all these different things, moving the data from where it needs to go to make sure it's presented and it follows you to the next provider as you move your address or just switching providers or going from specialist to specialist and help you manage different care conditions. And I think this guided approach, starting with navigations, completing with tasks, and just moving everything around, it's kind of how I see the vision of what's going to happen. I think we're going to live in a world where we're all going to have this agent or concierge that's going to help us with different things, particularly in this very fragmented industry like healthcare, that help put together, make it seamless, and timely appropriate care. That's really what we're after. And I think it's going to happen. Maybe not in 5 years, but I'm very hopeful that within 10 years, a lot of it is going to be addressed.
That would be great. And I know that this technology, along with a lot of the innovation that's happening out there right now, the goal, as you said, is that access to care and saving lives, right? So that's what everybody wants to do. And if we can make it a little bit easier and reduce that friction, it's worth looking at, right? Like just taking a look at some of these technologies that are available.
Absolutely. Everything starts with the door, right? Like your home starts with a door, every business starts with a door. And I think access is that door into healthcare. And if you can make it open, accessible, available, and actionable, I think that's going to make critical impact to healthcare and to just benefit of health for all.
Thanks again for joining me today, Alex.
Christy, thank you so much for having me. Really enjoyed our conversation. Some great questions. Always happy to come back if we have more interesting topic. Healthcare access, it's my personal mission. It's the mission that PatientGenie has engaged in and will continue to engage. I think it's just very important to make healthcare more accessible for all individuals and their families. And we're going to continue working to address this as much as we can, just for everyone involved on the patient side, on the provider side, and on the health plan side. Once again, thank you so much for having me today.
Alex, thank you for joining me today and sharing your insights on how agentic AI, telehealth, and smarter care navigation can improve patient access, ease workforce strain, and reduce cost. Your work with PatientGenie is a powerful example of what's possible when innovation is grounded in timely, appropriate, and truly human-centered care. Conversations like this remind us while technology continues to reshape healthcare, leadership, culture, and a people-first mindset remain essential to building systems that work for patients, providers, and the organizations that support them. For our listeners, you can learn more about Alex and PatientGenie by connecting with him on LinkedIn and visiting PatientGenie.com. And for additional healthcare recruitment, workforce, and leadership insights, be sure to explore the PracticeLink Resource Center at PracticeLink.com. As always, welcome your feedback, questions, any ideas for future episodes. You can always reach out anytime at plmedia@PracticeLink.com. My name is Christy Bray. Thank you for joining me on another episode of Workforce Wisdom.